Physiowebseries Knee Complex Season 1. Let's begin with Series 9. In Series 9, we will be discussing about patellofemoral joint stress. So as in this diagram, we can appreciate that in the center is the patella. Superiorly, there is quadriceps tendon and quadriceps muscle. Inferiorly, there is patellar tendon. So on the patella, there is a force or a pull by quadriceps tendon upwards in this direction, and to resist this there is a downward pull by the patellar tendon. And when there is a resultant of this, the reaction or resultant force seen, there is a posteriorly directed compressive force on patella. And this compressive force on patella, posterior compressive force on patella, increases as the knee flexion progresses. And if there is quadriceps contraction present, there is active contraction of quadriceps, the pull will be summated, that is the elastic pull of the tendon during the movement, during the knee flexion, plus the force exerted by the quadriceps muscle will add on. And if it's not the case, then only the elastic tension will work with passive elastic tension, that is passive elastic tension. So the total joint reaction force will be influenced by the magnitude of active and passive pull of quadriceps as well as the angle of this knee flexion. So either without the contraction of the quadriceps there will be the passive force alone, or when the quadriceps is there in picture exerting the pull on the patella, so there will be passive plus active pull. Along with it, there is one thing, that is angle of knee flexion. Those factors will influence the total joint reaction force on patella. Now, as the knee flexion progresses, the angle of pull between this quadriceps tendon and patellar tendon decreases, and due to that the patellofemoral compressive force increases. So as this goes beyond, there will be more posterior compressive force on patella. And if we consider activities such as walking or running, the daily activities, if we consider walking, so in the stance phase of walking, there is approximately 20 degrees or about 20 degrees of knee flexion occurring, and during that stance phase of walking with 20 degrees knee flexion, the compressive force on the patella is 25 to 50% of the body weight. Whereas in running, there will be more compressive force, which is about 5 to 6 times of the body weight. So as there is deep knee flexion occurring, so during the deep knee flexion exercises, the quadriceps force exerted will be more to withstand the body weight up and to create that pull. In deep knee flexion exercises, the quadriceps force will be greater, and in those cases there will be increased compression force on patella. So as we know, the knee flexion increases. As the knee flexion increases, there will be more posterior compressive force on patella. This is the basic concept based on which we saw certain things. Now, in a normal patellofemoral joint, the medial facet, which in this diagram can be appreciated on the posterior surface of patella, the medial facet, which is this one marked right now, that medial facet will bear more of the compressive force exerted on the patellofemoral joint. So also, but during the knee flexion, as it starts and as it progresses, till 90 degrees of knee flexion at least, there is mechanism which will minimize or dissipate the compressive force exerted on patella. And this actually is required during knee flexion, because during knee flexion we saw that the compressive force on patella was increasing progressively. During knee extension, there is no such pull by quadriceps tendon and patellar tendon to resist it. So, there is no requirement to minimize the compressive force because the compressive force is not that much to withstand it. So, during knee flexion, as we require to minimize that or dissipate that force, that dissipation of the force is done by increasing the contact area of the patella. So what happens is, as knee flexion progresses, mostly during the 30 to 70 degrees, 30 to 70 degrees of knee flexion or till 90 degrees of knee flexion, the area of patellar contact increases with femur. So the area of patellar contact is increasing, as we can see in this diagram. This is the start of knee flexion. Now see, as the knee flexion is progressing 60 degrees until 90 degrees, the area of patellar contact is more with femur around the up or down around the femoral condyles. As in flexion, the patella will glide inferiorly. So down, moving down around the femoral condyles this way, the patellar contact with femur is increasing. So in this range, till 90 degrees of knee flexion, the area of patellar contact increases, and which will dissipate the compressive force on patella. Hence will help to minimize the compressive force exerted on patella or patellofemoral joint. But beyond 90 degrees of knee flexion, again we can see over here, as the patella is lodged in the intercondylar notch. We had seen this earlier in earlier sessions, earlier series too. So at full knee flexion, or as the full range of knee flexion is approaching beyond 90 degrees of knee flexion, the patellar contact will reduce again, can be seen over here. So the patellar contact is reducing, but there is some other thing which is making contact with femoral condyles, which will again decrease the compressive force. So which is that? That will be quadriceps tendon. So this time beyond 90 degrees of knee flexion, there will be contact of quadriceps tendon with the femoral condyles. Instead of patella, there will be quadriceps tendon making contact with the femoral condyles, and this will help reducing the compressive force on patella. So these are mechanisms which minimize or dissipate the compressive force exerted on patellofemoral joint or patella as the knee flexion progresses. Also, with this increase in the patellar contact, especially during 30 to 70 degrees of knee flexion, there is one more thing, which is, we know that patella acts as pulley. It increases the momentum of quadriceps. So less quadriceps force is required. Quadriceps will have to generate lesser force comparatively. The work or the burden or the load of quadriceps will reduce because of patella acting as pulley. So in this case, the same amount of torque production will require comparatively lesser force production by quadriceps muscle, which will also help in decreasing the compressive force on patellofemoral joint. Other than this, one more thing is that the thick cartilage. The thick cartilage, which in this diagram, if we understand, there is medial facet making more of contact, normal femoral joint. We discussed that. So also there is thick cartilage mainly behind this medial facet of the patella, which is going to make more of contact with the femur, that is in patellofemoral joint, and this thick cartilage will also help in reducing this compressive force, as it is able or it is capable of withstanding this compressive force. Hence the joint which is liable to take all this force, so that joint will have less of burden to take over this compressive force. So this is basic to understand, that the patellar contact which is increasing as the knee flexion progresses. Another thing is that beyond 90 degrees, the quadriceps tendon making contact with femoral condyle. These two will decrease the compressive force on the patella. Along with this, the presence of thick cartilage at this medial facet portion will also help in reducing some amount of compressive force on patella, because it is capable to withstand this amount of force. Now, let's move on to one clinical aspect, the clinical part. We use straight leg raise exercise SLR to strengthen the hip flexors, knee flexors. Basically, after static quads, which is the static exercise, isometric exercise, to progress from that to strengthen the quadricep muscles, we use SLR, the basic thing to understand. So, at full knee extension, we saw just now that the posterior compressive force on patella is minimized, because the pull of this quadriceps tendon and patellar tendon is automatically reduced. If this is in flexion, then in extension it is automatically reduced. So at full extension, the posterior compressive force exerted on patella is minimized. Hence in SLR also we can see that the extension of knee is maintained. So this is the rationale behind it for using this SLR or straight leg raising exercise to improve the quadricep muscle strength, because in full knee extension as maintained in SLR, the posterior compressive force on patella is reduced. And in this position, while strengthening the quadriceps muscle, we will not exacerbate or increase or create any kind of patellofemoral pain. So patients who are having this patellofemoral pain, in those specifically, going for SLR is much beneficial. Or any other patients where the pain is present, pain is the presenting factor, going for SLR helps, because the posterior compressive force on patella is minimized in this position, and also at the same time we can strengthen the quadriceps muscle. Now moving on to another concept. In earlier series, we saw what is patella alta and what is patella baja. The normal alignment of patella, if compared, we can see in patella alta, the position of patella is higher than normal. In patella baja, the position of patella is lower than normal. Now, how this affects the compressive force on patellofemoral joint? So in patella alta, as we know, the patella is higher, or the patellar tendon is longer, and that is the reason why patella lies higher in position than the normal one. So the longer patellar tendon is there. So because of this change in position, as if we consider the patella alta, there will be delayed onset of contact or delayed contact between quadriceps tendon and femoral condyles. So after 90 degrees of knee flexion, we saw that patellar contact surface was not increasing. So at that time, the quadriceps tendon came into picture to build contact with the femoral condyles, as we saw over here, that beyond 90 degrees, the patellar contact is minimized. Now there is contact of quadriceps tendon with femoral condyles, which will reduce the compressive force on patella. So that is only discussed that in patella alta, where the patella lies higher than normal position, there is delayed onset of contact between quadriceps tendon and femoral condyles. So in this case, as the flexion will progress, as the knee flexion will increase, the compressive force will rise, because the patella obviously is not there into picture to increase the contact force. And in this case, in patella alta, the quadriceps tendon, which was there normally in normal condition, but in patella alta, that contact is also delayed. So the contact area, which normally increases to dissipate the compressive forces, is now absent as the quadriceps tendon is making delayed contact with femoral condyles. So as knee flexion is progressing, the compressive force will rise. And who has to bear it? Here, the patellofemoral joint or the patella has to bear this compression. So the longer patellar tendon is the culprit here for placing the patella at higher position and delaying the contact of the quadriceps tendon beyond 90 degrees of knee flexion, which is causing problem, and hence the compressive force is rising. Now in patella baja, as we know, the patella is lower in position than the normal one, and this is because the shortened patellar tendon. The shortened patellar tendon is there, hence the patella is pulled little downwards than normal. So now in this case also the problem is that there will be earlier contact between the quadriceps tendon and femoral condyles, again considering as knee flexion progresses. So if we take into consideration beyond 90 degrees itself, where the patellar contact area is not increasing, patella is out of contact, going out of contact again at the end range of knee flexion or beyond 90 degrees of knee flexion. Here the quadriceps tendon will make contact with femoral condyles, which is more of important to consider. But in patella baja, again the culprit is the short patellar tendon, because of which the patella is sitting in lower position than normal, and which will cause earlier contact between this quadriceps tendon and the femoral condyles within that specific range of motion of knee flexion. And this will cause reduction in that contact area, that contact force, which was dissipating the compressive force, helping to reduce the compressive force on patellofemoral joint. So here in patella baja, there will be earlier contact between the quadriceps tendon and femoral condyles and that specific range of motion of knee flexion, and hence reduction in patellofemoral contact force. So here also the contact force is reduced, which we want at that particular point to reduce or dissipate the compressive force on patella. So this was again another clinical aspect added. So this series was about patellofemoral joint stress, how the quadriceps tendon pulling on the patella and the patellar tendon resisting this pull, and both of these forces acting in opposite direction during the knee flexion as the knee flexion progresses. So this will cause a resultant joint reaction force posteriorly, which will compress the patella. One more thing to consider is that, as we discussed, there is thick cartilage at the medial facet posteriorly, can be seen. In the articulation of patellofemoral joint, there is thick cartilage over here in this diagram, if we consider. So if this cartilage is absent, or if this cartilage has been eroded, has been destroyed, we can think of a condition named as chondromalacia patella. Chondro means cartilage. So deficiency of that cartilage over here will also cause problem, which may be discussed in upcoming series or upcoming season. But here we came to know that the role of this thick cartilage is also important, as it helps to dissipate some amount of compressive force, which if absent may cause problem, as the presenting condition named as chondromalacia patella. That's it for today's series 9 of Knee Complex Season 1.